Welcome friends to our Art and Creation YouTube channel. In case you have not subscribed our channel, then please subscribe it now and press bell icon for new notification. As we commit to come up with another important topic, personality disorder, under the umbrella of mental health issues. So without taking too much time between you and your topic, we straightforward move to Dr. Hemika Agrawal to understand the personality disorder.
Personality disorders are a group of disorders which have been classified in ICD-11. They have certain criteria. The crux of these disorders is that the personality of the person is such that it leads to disintegration of the person from the society. It causes distress to the person and it somewhere interferes with the person being productive and being a normal part of the society. Here the definition of normal has always been a controversy. We as of today don't have a uniform definition of normal. We usually consider what is average and use it synonymously with normal. So normal or average, if a person does not fall into that and is at the other extreme, either extremes of the curve of normalcy, then we label them as having a personality disorder with respect to the personality traits.
How could one understand that person is suffering from personality disorder?
See, there are grossly 3 clusters of personality disorders. A few types of personality disorders would be a common one is antisocial personality disorder, which most of us will be acquainted with. People suffering from antisocial personality disorder tend to come in conflict with law again and again. They tend to break rules. They are usually fearless, usually impulsive. They have traits of impulsivity. At times they have overlapping features of impulse control disorder. They have features of borderline personality disorder. They can have features of histrionic personality disorder as well. These are grouped together and form a cluster because they usually are not exclusive. They have symptoms of one another, and in antisocial personality disorder, the core feature which it comes to light is conflict with law, conflict with the rules of society, and by multiple incarcerations, that is getting into legal facilities again and again. This is one example. Another would be anxious personality disorder, anxious avoidant. A person suffering from anxious avoidant personality disorder. Disorder I am mentioning, not traits. A person suffering from such a disorder would not be able to integrate himself in society because he would have severe anxiety, severe low confidence, and severe problems with having a good image of himself in his own eyes, low self-esteem, and severe anxiety when a person is exposed to social situations. If these symptoms are present to a low extent that the person is able to integrate, then we call such a person having traits. The person is having traits. But if a person is disintegrated from the society, has problems in the workplace or in the social place, then we label the person as having a personality disorder. See, we label personality disorders after the personality has been consolidated, which usually does not occur after till late teens, like 17 or 18 years of age. Only after that we label a person as having a personality disorder. In children, the personality is developing. So there we do not label a child as having personality disorder.
Which is more complex, personality disorder or bipolar disorder?
Personality disorder is classified separately from bipolar disorder in ICD-11, which we follow in India. It is an entirely different entity of disorders. Although people suffering from one illness are not exclusively, they can be suffering from other illnesses as well. A person suffering from bipolar disorder can also have a personality disorder, but they are not usually mutually exclusive. They can be inclusive also, but they are separate entities. We as experts, we should not compare diagnoses. If we have to see the severity of an illness or a person, it has to be the person itself and not the label, because a person with bipolar disorder with severe depressive episode with suicidal symptoms and with suicidal ideation can be more dangerous than a person with mild personality traits or anxious avoidant personality disorder. But a person with antisocial personality disorder can commit homicide as compared to a person with bipolar disorder who's maintaining well and is on treatment. So we cannot compare labels, but it is the condition of a person itself, the condition of the specific person itself and their illness, which determines how serious the illness is, whether they require admission, and what sort of help they require.
It is treatable.
Unfortunately, personality disorders do not have a very good outcome. Bipolar disorder has a better outcome with medicines and therapy, but personality disorders usually are resistant to treatment. Cluster C, that is anxious avoidant personality traits, etc., have medications which are quite useful, which can improve a large variety of symptoms. They can improve the anxiety and the depressive symptoms which occur frequently in anxious avoidant personality disorder and other cluster C traits, cluster C disorders. But people suffering from cluster A and cluster B disorders, personality disorders, they do not have a very good prognosis with either medications or therapy. Although this should not deter us from giving them help, because some people do improve, some people do show improvement, and it's worthwhile. Such people are worthwhile giving an effort into and trying to help them, because even if some chunk of them improves, it is worth it. Even if all of them do not improve, some do improve, and that is a fair amount. We should try and we should not lose hope.
What are the common causes?
It has both. The hypothesis behind the cause of personality disorders are both nature and nurture. The hypothesis behind personality itself is both nature. Nature is what the person's basic persona, God given composition is, and nurture is the environment. So sometimes people mention that their past has a lot to do with how they are today, but it is both the effect of their past and their environment, as well as their intrinsic genetic makeup, biological makeup, which leads to the development of a specific personality, or if the personality is not integrated, to the development of personality disorder.
Genetic disorder is also a cause.
Personality disorders also have genetic basis, and some disorders are common in people having mental health issues, mental health diseases as well. So many or most of them have been found to have a genetic predisposition as well, but environmental predisposition also has a role, and it is not either entirely genetic or environmental. It is usually a combination of both.
Thank you, doctor, for your support to understand personality disorder for our audience. Friends, we return soon with a new subject with new information. Till then, stay safe, stay healthy.